Welcome to the American Institute of Healthcare Professionals Videogram on holistic health, a look at complementary, integrative, and alternative benefits. My name is Mark Moran, and I'm filling in for Dr. Flary. And what we're going to look at in this particular video is holistic health and what it is and its benefits, and also maybe some of its disadvantages. This video is primarily set up for those within the holistic nursing program itself. So what is holistic health? Holistic health looks to implement herbal and other alternative therapies, other alternative modalities to supplement, or in some cases replace, complete reliance on pharmaceutical or Western drugs themselves. Holistic health looks to treat the whole person, mind, body, and soul. And it looks to find balance within all of the body's systems instead of just focusing maybe on one system itself. It is preventative in nature, but it can also aid in acute healing. But for the most part, individuals need to utilize it over a long span of time in an idea of preventing something down the road, maybe something in one's family history. Now, it is gaining popularity, but it's still extremely important that it is supervised through healthcare professionals who are properly trained, such as nurses or physicians who have certifications in holistic nursing or holistic health itself, and who are able to help numerous individuals understand how to integrate it properly with a current regimen of medication from a pharmaceutical standpoint. The benefits are numerous when it comes to not just utilizing herbs and other alternative modalities or supplements, but also having a holistic mindset itself. Those who practice holistic health are more health-orientated individuals. They are educated. They focus on what their blood results or labs are, and they look to make change. They look to implement change in their lifestyles. So this pursuance of knowledge and understanding its systems is very proactive, and it allows individuals to take control of their overall health and lifestyles. One of the other large benefits of holistic health practices, especially with herbs or other alternative therapies, is that they are supplemental. They do not have to replace conventional medicine or something that is pharmaceutical. They are supplemental and can aid if used properly. They can enhance if properly. And in doing so, they also, if used properly, have less negative side effects as many pharmaceuticals have. So with less side effects, that also helps in the overall healing process itself. In regards to preventative, something that we had mentioned, if a person has diabetes or high cholesterol within their family history, one can look and engage in herbal remedies as a preventative in their earlier years to prevent problems from occurring later in life. So holistic health in itself practices are really an answer to many overpriced pharmaceutical entities and the drugs that they push at their very high and exorbitant prices themselves. And these charges for these particular drugs cost millions and millions to Americans and families across the world. So being able to have access to alternative modalities can be very, very helpful, price effective, and help individuals to supplement maybe things that they wouldn't maybe nevertheless come across. Now, there are disadvantages, but the true disadvantage is only when it's misused. Individuals who wish to play quote unquote doctor can dangerously start to mix herbs that should not be taken together. You just cannot simply look things up online and then take this herb, and that herb, and just take them all together without supervision, without a healthcare professional supervising what you are taking for itself. For example, an SSRI, which is usually used for depression, or in some cases also OCD, should never be mixed with herbs such as St. John wort or even 5-HTP, because they all look to increase serotonin. If they are both used at the same time, this would create an overdose of serotonin, which can be fatal to the body. Now, this is just one example of dangerously mixing herbs with pharmaceutical drugs without consulting a medical professional. And this is why you should not. Another example is when individuals decide without consulting their healthcare provider to discontinue a particular drug in place or in lieu of a holistic health herb. So if someone just automatically goes off a prescribed drug or a controlled substance, withdrawal can still occur. Those who are experiencing ADHD or OCD or depression cannot suddenly go off a particular drug. Instead, they have to be weaned off this particular drug. Others may stop particular drugs that control their sugar or their high cholesterol, and this can be catastrophic to their health, especially if the herb isn't properly used that is meant to replace what the doctor has. If it's a statin, say, for high cholesterol. Also, in some cases of severe disease, individuals need conventional or Western medication for more acute situations. So those who are on cancer treatments or chemotherapy should not discontinue this basically based on a drug itself that they read about, an herb that they heard about. These should not just simply replace proven treatments that deal with the acute stages of cancer and so forth. Instead, they should be consulted with a physician in regards to supplemental use and if it can be used with some of these treatments, such as chemotherapy itself. Finally, herbal remedies, although old and wise in their history, they are still not approved FDA. They have not gone through the empirical scientific method with enough case studies. Now, more and more are becoming and appearing, but the strict case study empirical process that is followed through pharmaceutical drugs are not adhered to for herbal drugs. So while it's probably going to do a certain good just from hearsay, it's still not empirically proven, even though tradition has said it does so. So how much of it is a placebo effect versus just an individual hoping that something works instead of the pharmaceutical drug doing all of the work because it's been tried and proven. Now, again, this is not a disadvantage to holistic health, nor does the fact that there is not an empirical method implied to it mean that these substances will not do that. I think there's enough proof from just individuals taking it to show some type of progress in terms of dealing with a particular ailment itself. But again, it's not FDA approved, and that would be classified and listed as a potential disadvantage. We offer here at AIHCP an integrative and holistic healthcare specialist program. It's open to nurses and other healthcare professionals, primarily nurses though. Our holistic nursing link is below. Our number is 330-652-7776. On there it says 776, but again, it should be 330-652-7776. And the email is info@aihcp.org. Again, my name is Mark Moran, and I'm filling in for Dr. Fleury regarding this holistic video. Have a good day, and thank you for listening.